mother, and no matter how early it is, it's best that as soon as you find that you're pregnant, you start doing your doctor visit. Hey guys, welcome back to my YouTube channel. You know, it's your girl Devon, and it's all about the babies. Yes guys, it's all about the babies. So today we are here with another fun yet informative video. So today's topic we'll be talking about complications with pregnancy, and in this video I'm going to give you 4 common complications that can happen during pregnancy. But we all know that we wouldn't want any complications during pregnancy because, of course, children are a blessing. So we want every pregnant mother, and we wish every pregnant mother a successful pregnancy and a safe delivery. Most pregnancy occurs without complications. Of course, that's what we want. However, some women who are pregnant will experience complications that can involve their health, their baby's health, or both. Oh my, and this is not what we want. Sometimes diseases or conditions the mother had before she became pregnant can lead to complications during pregnancy. Some complications occur in delivery, even at the last minute. So it's best that we are well aware and we research all these complications, what can happen. Not to get ourselves frightened and anxious and worried, but just to be alert and know what is what and what can happen from what can't happen. As I spoke to one of my doctor friend recently, she said to me, and she's a midwife and a mother, I said, delivering all these babies, what's your biggest concern? And when you were delivering baby, what was your biggest fear? She said her biggest fear is because she knows all the complications. That's why she worried, because she knows everything that can go wrong, because she's a doctor. And most of our mothers like myself, when we go into labor or during pregnancy, we don't really do research on what can happen or go wrong. We just hope for the best, but never prepared for the worst. In your case, as a pregnant mother or as an expecting mother, or you're planning to get pregnant, it's best that you equip yourself with all the necessary information, good, bad, and of course, indifferent. But here's a little tip of 4 common complications that can happen during pregnancy. Some of the most common complications of pregnancy would include high blood pressure, gestational diabetes, preterm labor, and a loss of pregnancy or miscarriage. The first one that we're going to talk about today is high blood pressure. High blood pressure occurs when the arteries that carry blood from the heart to the organs and the placenta are narrowed. High blood pressure is associated with a higher risk of many other complications. So this is one thing that you can stay away from, or you want to stay away from. It puts you at a higher risk of having a baby well before your due date. This is called preterm delivery. It also increases your risk of having a baby It also increases your risk of having a baby who's small. It's important to control your blood pressure with medications during pregnancy. So if you're a mom and you know that you're entitled to have pressure before becoming pregnant, it's best that you always take your medication and visit your doctor regularly. More regular than somebody who does not have high blood pressure, because we know that sometimes the least little worry or stress can hike up the pressure or lower it really low, depending on which one of the pressure you as a mother who that travels with. It's best to stay away from salty things that you know that also contribute when you to pressure, high blood pressure when you have it. So it's best to stay away from these things when you find out that you're pregnant. Another one is gestational diabetes. Gestational diabetes occurs when your body cannot process sugars effectively. This leads to higher than normal levels of sugar in the bloodstream. Some women will need to modify their meals to help control blood sugar levels. Others may need to take insulin to keep their blood sugar levels in control. Gestational diabetes usually resolves after pregnancy. So all these conditions can occur while becoming pregnant. So you can be a person not having high blood pressure, but as soon as you became pregnant, this is a sickness that comes with it. Not often, but it can occur during pregnancy. So and also gestational diabetes, as we mentioned before. When you become pregnant, because of the amount of sugar in your blood system now, you can get gestational diabetes. But this always resolved after pregnancy. So as soon as you deliver the baby healthy and not healthy and everything is okay, then of course this too shall gone. This too shall leave. Healthy and normal. After you deliver your baby healthy and normal, then the gestational diabetes, of course, will get better and you will no longer have it. The other one that we'll talk about is preterm labor. Preterm labor occurs when you go into labor before week 37 of your pregnancy. So you know some person will say you have the baby early. And you know that some person will say the baby is premature, you can have baby at 7 months. Another person say it is very rare that a baby that is born at 8 months lives. And I think that this is a myth. A lot of time babies that are born at 8 months and they still survive and they are very healthy. This is before your baby's organs such as the lungs and the brain have finished developing. Certain medications can stop labor. Doctors usually recommend bed rest to keep the baby from being born too early. And as a mother or as a pregnant mother, if you're an active person, this too can lead to preterm labor. So it's good to be active when you're pregnant, but of course not too active when you're pregnant. It's best to always take as much rest as needed, because this can contribute to the health of your baby and to your health as a mother. We'll be looking at is miscarriage. A miscarriage is the loss of pregnancy during the first 20 weeks. According to the American Pregnancy Association, up to 20% of pregnancy among healthy women will end in a miscarriage. Sometimes this happens before a woman is even aware of the pregnancy. In most cases, miscarriages isn't preventable. Wow. A loss of pregnancy after 20 weeks, after week 20. A loss of pregnancy after week 20 of miscarriage is called a stillbirth. Many times the case for this isn't known. Issues that have been found to cause stillbirths include problems with the placenta, chronic health issues in the mother, or infections. So that's why it's best as a pregnant mother, and no matter how early it is, it's best that as soon as you find that you're pregnant, you start doing your doctor visit. Visit your doctor regularly. So you're checked and we doctor regularly. So if any of these complications is going to happen, the doctor can cite it at an early stage and prevent it as well as control it, so you and your baby have a safe pregnancy and a safe delivery. You know, it's your girl Devon. Thank you for watching my YouTube video. See you in my next video, and I hope that this video was very informative.